know that, of course, the Canadian system is not perfect, but I think many Canadians, in a very polite way, take some umbrage to some of the myths that we hear propagated about Canada and the American healthcare debate. I'm wondering if you could tell us what is the most important myth to bust about the Canadian healthcare system, and what can the people in this room do to help you bring facts to that conversation?
Good question. I was on at a hearing in the Senate, and some senator said, you know, if you have health care as a right, it means that physicians are slaves. Now try to follow this logic. Stay with me. Because if I have health care as a right, I can knock on your door at 4 o'clock in the morning, and you must provide health care to me at that moment. Therefore, you are literally a slave was the word used. So my question to the American physicians who were up there on the panel was whether or not they believed they were living in slavery. You will not be surprised to know that they did not. The other issue is quality of care. Yeah, it's great to be able to provide quality of care. It's great to be able to provide health care to all people. Quality is substandard. Waiting times are interminable. People get ill, they can't get in to the doctor when they need it. And again, I think what we all know, and you know is better than anybody, you wrote a book on the subject, Canadian healthcare system is not perfect. It has its problems. But I think there are just a whole lot of very intentional lies and distortions. These are not misunderstandings. These are very intentional lies in order to try to convince the American people that the current dysfunctional system we have is the best that we can do.